Morning girls, we're going to go through today the correct selection of your treatment lotions. We've got 3 treatment lotions and it's just a matter of knowing which one to choose and why you're basically choosing it. So how do you select the correct treatment lotion? Now you're going to see a pattern here with the questioning that I do because it was exactly the same with the cleansers. The first thing you need to look at is there redness? And I'm going to go through why in a minute. That's the first thing you're going to look at. The other thing that you need to be looking at is, do they have blackheads? Now blackheads, as I explained in the first training video, are not sebaceous filaments. They are blackheads. So they're isolated and they're not all together in like a crop like on the chin. Do they have pigmentation as well? That's another consideration that you're going to be looking at because, you know, the treatment lotions, there'll be ones that are better than others. So the first thing we want to address is the redness. Now, why do you think that that's the first thing that we need to address? The reason is because if you've got redness, it's a sign that they've got a disrupted skin barrier. And that means that interleukin-1 is being released. There have been studies that have shown when you've got a disrupted skin barrier, interleukin-1 is released in the skin. Now what's the big deal about interleukin-1? Well, for a start, if they're acne, interleukin-1 creates what we call hyperproliferation of the skin cells, which means in simple terms it makes them form too many dead skin cells, which is one of the things they've got as a problem in the first place with acne. So we do not want a disrupted skin barrier with acne at all. So it's not just acne that this affects. Interleukin-1 also, when it's released in the skin, stimulates what we call matrix metalloproteinases, or MMPs for short. Now what these delightful little molecules do is they basically eat your collagen and elastin. So again, we don't even want redness or inflammation in a dry skin because it's going to have interleukin-1 being released as a result of it. So that's why the first thing we need to address is redness. So if you've got someone who comes in who is acne prone, the first thing you're going to be looking at is, do they have redness and is their skin barrier impaired? Because if it is, that's the first thing you need to address. Because until you get that under control, you can do all the peels that you want or all the fruit acids that you want and throw at it, but the fact that they've got an impaired skin barrier means their skin cells will still be hyperproliferating, and what we want to do is restore that skin barrier so that the skin cells stop doing that, and that will in turn reduce the amount of acne that they're getting. So I'm just going to basically go through the 3 treatment lotions. The hydrating treatment lotion is absolutely beautiful. It does not sting at all. So if you've got someone who has got a super sensitive skin, it is fantastic. Now, the benefits of the hydrating treatment lotion is it has got aquaporin regulators in there, and I'm going to go through what they are in a minute. It's got niacinamide or vitamin B3, and polyaminopropyl biguanide is actually the preservative. So aquaporins are actually integral membrane proteins that form pores in the membrane of biological cells. So what this basically means is the pore is actually like a shuttle for moisture. So where there is an aquaporin, it will allow moisture into the skin. So basically the aquaporins have been identified and they've been divided into 2 groups on the basis of their permeability. So we've got aquaporins 1, 2, 4, 5 and 8. And they're water selective ones, and we've got aquaporins 3, 7, 9 and 10 called aquaglyceroporins, which transport water as well as glycerol and some other solutes. Now the main one that we're concerned with is aquaporin 3, as this is the one that's most been shown to affect skin moisturization, so that is basically the one that we want to deal with. So we basically have a whole pile of aquaporins in the hydrating treatment lotion. We've got urea, we've got yeast amino acids, we've got trehalose, we've got inositol, we've got taurine, and we've got betaine. Most of these are nature derived. The majority of them actually come from yeast cells, so it is a natural ingredient even though it doesn't look like it is. So basically what they do is they increase the moisturization of the skin, and they also stop the skin barrier from being destroyed as much and it also helps with skin elasticity. So trehalose is a water binding molecule that protects skin in freezing temperatures. Now, I haven't gone into it in this training, but basically the lipid bilayer in the skin, when the temperature starts to get colder, the actual membrane isn't as fluid. It's not as able to fill in gaps in the skin as much, which is why during winter our skin dries out so much, because normally the skin barrier, like the lipid bilayer, will actually fill in these gaps, and it can't do it. So the fact that trehalose has that property where it protects the skin in freezing temperatures is awesome. Another thing that does the same thing is glycerine. Glycerine does the same thing. It actually stops or protects the skin from freezing in low temperatures. So with the hydrating treatment lotion, it gives an increase of moisturization of 30% within 15 minutes of use, so it's immediate. It also outperforms glycerin with moisturization as well, and unlike glycerin, it doesn't feel sticky or tacky like on the skin, which is really important because no one wants to use anything that's sticky and tacky. Your niacinamide, which is in there as well, it increases the ceramide production in the skin. Now, ceramides are basically produced in between the skin layers, and they help to waterproof the skin, so they help to keep the moisture in the skin. And as we get older, we do not make as many ceramides as we used to, so that's why an older skin will tend to get dehydrated or dry out. So for someone who is an older skin who is not leathery, this would be a great option for them to actually help increase the moisturization of the skin. Niacinamide also protects the skin. So there's been studies that have shown that for people who are sensitive to external chemicals or the environment, basically that niacinamide helps them to stop reacting quite so much, which is really good for sensitive skins. It also inhibits pigmentation. Now, when I say it inhibits pigmentation, the skin cell, the keratinocyte, it stops the pigment being transferred to the keratinocyte, so it will actually help prevent pigmentation and lighten it. It's also anti-inflammatory as well. Niacinamide's got a host of benefits for the skin. It is the most under-recognised vitamin, I believe, for the skin. Now, the preservatives in the hydrating treatment lotion are the polyaminopropyl biguanide and potassium sorbate. Polyaminopropyl biguanide's been around for what have to be well and truly over 90 years now. It's been around for a long time. It's doesn't cause cancer. It's what we call teratogenic, which means it doesn't cause birth defects. It's got an incredibly safe history with use. If you're wondering why we don't use this in everything else, it's because it's cationic, which means it's got a positive charge and it doesn't always interact well with other chemicals. So there's a reason why it's not in everything. The really great thing about this preservative is you can actually put it on an open skin like an eczema sufferer and they get no stinging at all. It is awesome. So if you've got the super sensitive skins, to start with, I would put them on the hydrating treatment lotion. Some of your acne clients, when they come in, if they're really red, you may want to sell them a travel size hydrating treatment lotion. That way, the hydrating treatment lotion in the travel size will probably last them about 3 to 4 weeks. It should be enough to correct the skin barrier, and then you can start addressing the excess skin cells and start dealing with the blackheads and everything else. But if you put the berry lotion on when their skin barrier is still impaired, you're really going to slow down their results, because as I said, if the skin barrier is impaired, they're creating more dead skin cells, and you're not going to stop that process as much as what you would if you did the hydrating treatment lotion first and then changed. So the only difference between the hydrating treatment lotion and the vitamin treatment lotion is the preservative. That is it. There is no difference between them. They have the vitamin treatment lotion still has niacinamide. It still has all the aquaporins in it. It's just that the preservative is aspen pine bark extract. And it's a natural anti-inflammatory, and it's also got skin renewing. So this would be a good choice, the vitamin treatment lotion, for those who do have acne. Now, I will say that if your skin is really, really red or irritated, it may sting a little bit because of the aspen pine bark extract, because it is like a natural fruit acid. It's also a natural antimicrobial. So if they're super sensitive, change them over to the other. But the aspen pine bark extract does have anti-inflammatory properties, and that's in our rosacea range. So really, the choice between the two of them is basically whether it stings or it doesn't. If it doesn't sting, go the vitamin treatment lotion. If it's stinging, go the hydrating treatment lotion. And that's something that you're going to have to try on their skin, because you're not going to know until you put it on them. And generally, if it's going to sting, the response will be immediate. Okay, the berry retexturizing lotion. It's basically, predominantly I've thought of this as oily skins, and a few of you are getting confused about, well, can you use it for an aged skin? Yes, you can. If they've got a really thick, and I mean thick, sun-damaged, leathery skin, berry retexturizing lotion would be great. But realise that you're using it to help increase the cell turnover. It is not for lightening pigmentation. The best one for lightening pigmentation is either the hydrating treatment lotion or the vitamin treatment lotion. So if you think of the berry as increasing cell renewal, especially those with blackheads, their skin cells tend to be sticky and sluggish with turning over, so that's why we use it for that. We have tried with not using it and supplemented with enzymes on daily. It didn't work. So we've tried a few different things. So we know that for the acne client, long term, this is what they need to be on. So if they've got an impaired skin barrier, as I said, to start with, I would probably put them on the hydrating treatment lotion and then change them over to the berry once their skin barrier was repaired. It's basically got a natural blend of fruit acids. It's got a lot of benefits of glycolic. It doesn't irritate. I don't believe it does, and I've got a pretty sensitive skin. However, just be aware it does not repair the skin barrier. So that's why if they've got an impaired skin barrier, you need to be going the hydrating treatment lotion or the vitamin treatment lotion, basically.